Okay, a very good evening to all. I hope I'm audible and my slide is also visible. Can anybody please confirm?
Yes, ma'am.
Okay, thank you. So, yeah, maybe we'll start. For people who are joining for the first time, so I am Sharmishta Majumdar and I'll be the PMRF TA for this course, Maternal Infant Young Child Nutrition, which is being taken by Dr. Rupal Dalal from IIT Bombay. Right, so today we'll be discussing some problems related to the topics and the different matter that has been discussed with you in week 7. So along with going through the problems, I'll be also catering to the different so I'll be catering to the different queries that some of you had posted in the portal. So yeah, maybe we can just start with it. Yeah. So in the week 7, okay, now before going to the week 7, we have already gone through the week 6 matter where we have learned about the cross cradle hold, right? The cross cradle technique for breastfeeding. So we have come across the various advantages that are related to that technique and why a cross cradle hold is more advantageous to a cradle hold, right? So we have gone through I think we have gone through one problem in the last session which says about specific disadvantages that might be associated with the cradle hold. So today we'll be discussing more about the other kinds of breastfeeding holds, say for suppose the football hold or the laid back hold or the cradle hold or the lying down technique. So we'll be discussing problems on those as well. Next, we'll be also discussing problems on why some children are found to have poor gain of weight during breastfeeding, during the period of breastfeeding, and what are the specific factors which are responsible for this poor weight gain, and what could be the factors related to the mother and also the different factors related to the breastfeeding technique itself which causes this poor weight gain in children, and what might be the different ways through which the milk supply could be increased in mothers as well. You have gone through the breastfeeding during COVID lecture. So I will not be discussing much problems based on, this specific lecture. But of course, please go through all the lectures that have already been, the recorded lectures that have been shared on the portal. So we'll also be discussing about the expression of breast milk and how this breast milk can be stored for further use. And then we'll be also discussing and learn about different nipple conditions, as no human is the same, so no mother is the same, and what are the different physiological differences and what are the other things available to cater to those problems, and whether or not those are helpful in the long run or not. So let us now move on to our first question. So the first question says, cross cradle hold is the preferred technique for breastfeeding. Number 1, if baby doesn't need extra head support, in premature babies, in healthy or average babies, and D, all of the above. So what do you think is the answer?
All of the above.
Okay. Anybody else? Anybody
Option D,
else?
all of the above.
Okay. Anybody else who would like to volunteer for the answer? You can write down in the chat box also. Okay, let us go through the options again. So the first option says if baby doesn't need extra head support, right? So please read the options carefully. So the option 1 says if baby doesn't need extra head support. So as we know that the cross cradle hold is a breastfeeding technique which is usually given to the babies in the initial stages, and it is a technique which is given where the baby requires a proper or more of neck support, right? So our first option is definitely not the answer, because it says that if baby doesn't need extra head support. Let us go to the second option. So premature babies. Yes, premature babies, in case of sick babies or in case of low birth weight babies. So this cross cradle hold technique has been found to be very advantageous. So we can say, okay, premature babies can be the right answer. Let us go to C. So babies who are healthy or average babies, and which are babies who are capable of latching well onto the onto the breast during breastfeeding, so they usually can suffice with other techniques as well. So definitely the answer is not all of the above. Let us see the answer. So the answer is premature babies, right? Okay, so whenever we have babies who need extra neck support, so cross cradle hold is one such technique which is giving that neck support to the babies. And in case of premature babies or babies with low birth weight, so this cross cradle hold where the hand is the opposite one to the breast from which the breastfeeding is being done, right? So this technique is very much advantageous in case of premature babies. Okay, so I hope there is no doubt regarding this question. Is there any doubt?
No, ma'am.
Okay, so people who said all of the above, please read the options carefully. Okay, so let's move on to the second question. So the football hold is preferred in which of these cases? So as we discussed, the cross cradle hold, the football hold, the cradle hold, and the lying down hold. So these are all different techniques of breastfeeding, right? So what would be the answer for this?
Twins babies.
Okay,
Ma'am, option D, all of the above.
okay, okay. So I am getting a lot of mixed answers. So let us discuss. So the football hold is preferred in which of these cases? So let's look at the image first. So whenever we look at the image, when we are visualizing it, we can understand what are the different indications for these techniques, or which are the situations in which we can use this technique, right? So if a mother who has got a C-section delivery, so in this case also it is easier for the mother to hold the baby, right? So in case of a football hold, the name suggests it, the baby is being held like similarly like a football, like how a rugby player would hold the football, right? So in this case, the baby can be held in front where the face of the baby is facing the mother's face. So as you can see, yeah, so as you can see in this image, the face of the baby, okay, yeah, so as you can see that this is a front position where the face of the baby is towards the face of the mother. So this is one possible position, and a second possible position in the football hold is where the baby is taken from the sideways, right? So a side position. So this football hold, it is preferred in cases of mothers who have had C-section, and if mother has got large breast, right? So we can see that this also enables the mother to take a support from pillows which can be kept beneath the elbow, right? So definitely mothers with large breasts, they can also use this technique. Also twin babies, say for suppose the mother has delivered twin babies, and in this position it is easier to support both the babies on both the sides. So hence the answer to this question is all of the above, right? So we can use this football hold technique in case of C-section delivery, and in case of mothers who have large breasts, and also in case of twin babies, right? Okay. So we'll move on to the next question. What is the finger position of the mother on her breast in the football hold technique if the baby's face is directed from the front towards the mother's face? Please read the question carefully and go ahead with the answer. Anybody would like to volunteer? Why is everybody silent? Anybody would like to volunteer? You can write down your answers in the chat boxes as well.
Option C.
Option C.
Yeah.
Okay.
Option B.
Okay, so let us go through the question. So the question says, what is the finger position of the mother on her breast in the football hold technique if the baby's face is directed from the front towards the mother's face? So we have discussed this concept in our previous sessions as well. So please remember the major thing that needs to be taken into consideration, that the baby's lips and the mother's hand position should be parallel to each other, right? So this is the major concept that you need to keep in mind. So whenever you're considering the baby's position and the mother's hand position for the breast contouring, so this should be parallel with each other. So now if we have just so we have just seen the image where the baby is the baby is held in front and the face is directed, the baby's face is directed towards the mother's face, right? So this is the front position of the baby in the football hold technique. Now if we consider the baby's lips, so the baby's lips, they are in which position?
Horizontal.
Okay, yeah. So the baby's lips are in the horizontal position. But in this case, if we consider the football hold technique, now we need to hold the breast in a C-shaped position, right? So in case we are holding the C-shaped position, so in this case, how do we have to hold it? If we consider it as a clock, we have discussed this question last time, where we have seen that it is a 3 o'clock and a 6 o'clock position when we are considering the cross cradle hold. So in this case, what should it be? We have discussed this in the cross cradle hold, that the lips are parallel, right?
6 and 12 o'clock now.
Yes, the answer is 6 o'clock and 12 o'clock position. So if the breast needs to be contoured from the side, so that needs to be in a 6 o'clock and a 12 o'clock position, where the thumb and the different fingers, so where the thumb and the different fingers at the other fingers will be at a 6 o'clock and a 12 o'clock position to contour the breast as the baby is positioned, right? So in case of the football hold technique, please remember what we have seen previously as the 3 o'clock and the 6 o'clock position. It was in case of the cross cradle hold position, right? And now when we are considering the football hold position, so it is the 6 o'clock and the 12 o'clock position. So please keep in mind the different changes of the hand positions that occur based on the different techniques, right? So we have different holds that you must have gone through, the C-shaped hold and the U-shaped hold. So these depend as to the position of the baby and the positioning of the mother. So in whichever direction we have the baby, so based on that, the breast contouring needs to be done, or the hand of the mothers will be based on that position of the baby. Okay, so the answer to this question is 6 o'clock and 12 o'clock. So let's move on to the next question, which is not a desired breast shaping technique as it might cause nipple feeding. What would be the answer?
Option B, V hold.
Okay. Okay. So a lot of you have said V hold and somebody has said D. So the person who has said D, why do you think it's D? The question is, which is not a desired breast shaping technique as it might cause nipple feeding. Okay, let us move forward with the question. So as we have just discussed, like there can be various shapes as to how the breast tissue needs to be held by the mother, right? Based on the position of the baby, it should be adjusted as such. So let us see the answer. So the answer is V hold or yeah. So the answer is V hold, right? Or V hold is also known as scissor hold or scissor grasp. Now, whenever we are talking about the hand positions, say for suppose the C hold or the U hold. So the C hold, whenever we are approaching the breast tissue from the side, so that is being considered as the C hold, right? So we can see, just go through the image. The C hold, fingers below the nipple and thumb above in the shape of a C or inverse C, most useful if baby is positioned roughly vertically along the mother's body. So if we consider, if you remember in the last session we had discussed about cross cradle hold. So in the cross cradle hold, what we had seen that the mother is approaching the breast tissue from beneath in a U shape, right? So this U shape only if it is a modified shape. I mean, you can say that the U shaped and C shape, they are kind of similar, but it's just the direction. So if it is from the side, so we can say it is the C hold, and if it is, say for suppose if it is from beneath or if it is from the top, then we can say it is the U hold. So C hold and U hold, these are very helpful ways of contouring the breast. So these are the useful ways in which holds in which the proper latching can be mediated. Now, if we come to the V hold, so what we are saying, scissor hold or V hold, it is the way in which we say for suppose it resembles a scissor. So if a mother is now placing fingers like this on the breast, so it has or it leads to a tendency of nipple feeding. So as you can see here, the scissor hold, the forefinger and middle finger are on either side of the nipple, right? So if this is the hold in which the mother is holding the breast tissue, so there might be chances that the lower areolar part is not going inside the mouth properly. And if the if the lower areolar part is not ingressing into the baby's mouth, then obviously the latch will not be proper. So this will lead to an improper latch or in turn nipple feeding. So definitely V hold is not a desired breast shaping technique. So please remember this. C hold and V holds, they are the modified of the same position that are used as in different directions, say from the side and say from top or underneath based on different techniques. And V hold or scissor hold, it is not a desired breast shaping technique. Okay, so some of you had raised your hands. Does anybody have any question? Am I audible?
Yes, ma'am.
Yes, ma'am.
Okay, so I guess I think there were two people who had raised their hands, but it seems they are not here. Okay, so I guess this question is fine, or anybody has any other doubts?
No, ma'am.
Okay.
Fine, ma'am.
Okay, so we'll move on to our next question. Okay, so question, yeah. Okay, so the question says, in cradle hold for breastfeeding, the mother should hold her breast in which shape? So we have just discussed about the different shapes in which the breast tissue can be held by the mother. So whenever, okay, in cradle hold, okay. So what is cradle hold? Does anybody remember?
Ma'am, option B, from top in a U-shaped hold.
Yes. So whenever we are talking about cradle hold, yeah. So whenever we are talking about cradle hold, so this involves the same side, the same hand on the and the same side breast. So the baby is made to feed from the same side breast, and the support is also being given from the same side, right? So now if we visualize this, so how should be the position of the hand? So now the mother, if she's supporting her baby from the same side, say for suppose she's feeding the baby from the right hand side, and then her right hand is being used for supporting the baby in a cradle hold. So her left hand will now be used for the breast contouring, right? So if she is holding her baby, definitely she will not be able to give the support or do the contouring of the breast from beneath. So let us look at the answer first. So as we have just discussed, if it's not possible to give do the breast contouring from beneath, and it doesn't make sense if she does it from the side, right? Because she is holding the baby at the same side, and doing it from any other direction would make it very inconvenient for her and also for the baby. So the best way in which she can do the breast contouring is holding the breast from the top in a U-shape hold, right? So for the cradle hold position, as many of you have very rightly said, the most effective breast contouring technique or the hold would be from the top in a U-shaped hold, right? Okay. I hope there is no confusion regarding this. I am asking because some of you had answered other options as well. So
No confusion now because you have explained correctly.
Okay.
From top we have to hold it.
Right. So whenever you are getting questions like this, which mentions the different techniques, so please visualize. And when you visualize and when you think that, okay, this is the position, then you have to think whether this position or this hold would be convenient for the mother or convenient for the baby. So when you visualize it, you will be automatically be able to understand, okay, this is how the breast contouring should be done, or this is how the support should be given. And then it will be easier for all of you to answer these kind of questions, right? Okay. So we'll move on to the next question. I suppose somebody had also posted this topic as a query, as in this is not related to the options. I think, yeah, the answer is C, definitely. So when holding the breast for breastfeeding, the mother's thumb and fingers should always be at a distance. At what distance from the nipple? So as all of you have very rightly said, it should be 3 fingers, right? So as it has been already discussed in the lectures, that there are specific, like whenever we consider the areolar area as a excuse me. So whenever we are considering the areolar area as a clock, so we have specific sites where the position of the hand should be, right? And to get the optimal pressure on the breast tissue, so it is advocated that the 2 fingers should be situated equidistantly from the nipple. So it has been said that it is around 3 fingers. It should be around 3 at a distance of 3 fingers on both the sides to get a proper hold for breastfeeding, right? So I am not able to recall the question, but I am sure somebody had raised this question. So please go through the previous lectures, and there is a question related to this position of 3 fingers, the distance of 3 fingers. If you go through the previous lectures and if you go through the options carefully, I am sure you will understand that, right? Okay, so the answer to this question is 3 fingers. Now we'll move on to our next question. So we have learned about the cross cradle hold, the cradle hold, the football hold, right? Now we are moving on to something called the side lying hold. Yes, Dr. Patil, you have anything to say?
No. I think mother who had a cesarean section delivery.
Yeah. Okay. So we'll move on to this question. So when is side lying hold for breastfeeding recommended, right? So the option says when the mother has twin babies, when the mother has big breasts, if the mother has had a C-section delivery, and if the mother has had a normal delivery. So as you people have very rightly said, if mother has had a C-section delivery. So there were a lot of people who have raised queries regarding this as well. Like how if a mother has just had a C-section delivery, and how is she in a physical status to breastfeed, and whether it is possible to, because we have been saying that it is very important to breastfeed the child within the first hour after birth, right? So how to make this possible? If the mother has just given birth through a cesarean section, then the mother will be too weak. But then there are specific techniques through which the mother can be motivated to initiate the breastfeeding. So if the mother is not that much weak, or if she is not in a very urgent situation, or if that doesn't entail any other urgent measures, then definitely the side-lying hold or the football hold, these two breastfeeding techniques, they can be utilized for breastfeeding the child. And of course, we have also discussed about breast crawl. So breast crawl is an instinctive phenomenon from the child's part, right? So say for suppose if the mother is not able to actively breastfeed the child, but still if you put the baby on the mother's stomach, and then you can very easily observe that this phenomenon of breast crawl is very much existent, where the baby knows where to go and how to latch and start the first breastfeeding, right? So we'll go to the, yeah, yes, somebody had,
Ma'am,
yeah,
good evening, ma'am.
yes, good evening.
C-section, breast crawl done by from shoulder side, neck and shoulder side. Not in normal delivery. We suggest for from stomach lower means. But in C-section, we practice that from shoulder side. We doing that.
Okay. So of course, people who are practicing in the field, definitely you will be knowing more, and I will be definitely very happy to take suggestions from you all. So what I meant by when I mentioned breast crawl is that since there are a lot of other people who had raised this question, so definitely there are measures in which mothers can start with breastfeeding even after a C-section delivery. So that is the reason why I mentioned, but thank you for the information. So,
Ma'am, actually, it was there in our video.
okay. Yeah. So usually there might be, see, the thing is, there might be a lot of practices which are done based on the clinical scenarios, right? So hence, based on these questions, and the answers are based on these problems. So since some of you had asked, like, the mother can be very weak, and it is not possible for the mother to breastfeed the child immediately after delivery. So these are the probable ways by which they can definitely breastfeed the child, right? So so the answer to this question is if the mother has had a C-section delivery. So if the mother even has a C-section delivery, the mother can very comfortably breastfeed the child through a side-lying hold, or even a football hold, as we have just discussed previously. So we'll move on to our next question. In side-lying hold for breastfeeding, the mother should hold her breast in which shape? So we have discussed about this in the previous questions. So whenever such questions come, please think about it, how visualize it, and then you can easily say that this is the answer. Okay. So yes, others? I have received 2 answers. What about others?
B, ma'am.
Okay. So let's
Option A, ma'am.
so let us look at the image. So if you look at the image, So definitely, as the position suggests, as I had just discussed previously, the hold should be convenient to both the mother and the child. So this C-shaped hold from the side is definitely most convenient for the mother as well. So if we consider the answer to this question, the answer is from the side in the C-shaped hold, right? So if you consider the answer, the other option, say for suppose from the top in a U-shaped hold. So if the mother is lying like this, then she has to elevate her hand and position it like that, which is definitely very much inconvenient for the mother. And then option C, from the side in a scissor shaped hold. So scissor shaped hold, definitely it is not desirable. So that is eliminated automatically. Option D says from the underneath in a U shaped hold. So again, just imagine you have the baby and the mother needs to put her hand beneath and hold it. So definitely it might also be an inconvenient way because she is lying on her side. So when she is lying on her side, so it will be not convenient or not very helpful for her to get the proper grasp in a U shaped, right? So the most helpful one would be from the side in a C-shaped hold, right? I hope I've been able to clear the doubt for the person who said option D. Somebody had said option D, right?
Yeah. Okay, ma'am.
Yeah. Okay. So we'll move on to our next question. Laid back hold is not recommended in which of these cases? So laid back hold, as the name suggests, the mother is relaxing and she has got a laid back position and she is holding the baby in the laid back hold. So what do you think laid back hold is not recommended in which of these cases? So option A says if the mother is tired and has back pain. Option B says if mother has large breasts. And option C says if deep attachment of the baby to the mother's breast is not attainable through cross cradle or cradle hold. And option D says none of the above. So what do you think should be the answer?
Ma'am, C.
Okay. Okay, what about others? What do you think? So
Option D, ma'am.
Okay. So a lot of you have said option D and one of you have said option C, right? So let's go through it. So the question asks which is not recommended. Laid back hold is not recommended in which of these cases, right? Say for suppose if we have a mother who's very tired and has back pain. So definitely you would want the mother to stay in a position where she can be very relaxed. So that position can definitely be a laid back hold position, right? So option A is definitely a case where laid back hold is advocated. Now let's go to option B. So in option B also, if mother has large breasts, so this position, it ensures that a proper support is being given by the position, right? So let's go to option C. So if deep attachment of the baby to the mother's breast is not attainable through cross cradle or cradle hold. Say for suppose the cradle hold and the cross cradle hold have been tried, but the mother is not able to achieve that deep attachment of the baby's lips to her breast. The baby is not being able to do that. So in those cases also the laid back hold can be employed to see or to bring about the changes in the postures and to ensure that the baby properly latches onto the breast, right? So in this case, all the three are definite situations in which this position is recommended. So the answer to this question will be none of the above. Okay. So we'll move on to our next question. Which is true for laid back hold? The child's stomach rests on the mother's chest. The child's stomach rests on the mother's stomach. The child's head rests on the mother's stomach, and none of the above. So what do you think should be the answer? Okay. Anybody else?
B, ma'am.
Okay. Okay. So for the laid back hold, yes. So as most of you have very correctly said, it is option B. So in the laid back hold, the child is put in such a position where the child's stomach, it rests on the mother's stomach, right? So the answer to this question is option B. Okay. So let us move to the next question. The baby is turning his or her head from side to side. What does this indicate? So option 1 says the okay,
C, ma'am.
okay,
Option C, ma'am.
C, ma'am.
right. So what is this sign called? What is this signal called? This baby's signal where the head is turning from side to side?
Hunger cues.
Right.
Early hunger cues.
Yes.
Early hunger cues.
Yes. So this moving of the head of the child from side to side is called the early hunger cue, and this is very significant, where the mother needs to be very much attentive towards these hunger cues, so that she exactly knows when to feed the baby. So whenever the baby is salivating, or whenever the baby is opening his or her mouth very widely and moving his or her head from side to side, then licking lips, so these are all the early hunger cues which says that okay, the baby is hungry, right? So we have already discussed about these hunger cues in our previous session as well, where we have seen that apart from early hunger cues, so when the baby is not fed immediately, the baby starts showing different signals. I mean, the baby starts showing different features as well. So where now the baby starts becoming agitated. So the baby starts stretching, the baby starts squirming, and then the baby starts putting his or her hands in the mouth. And then these are all saying that, okay, now the baby is very hungry. And if we don't want the baby to reach the extreme stages where the baby can start crying, so then the crying would be the last stage of these, cues. So then the baby should be immediately fed, right? So the answer to this question is the baby is hungry. And how do we understand that the baby is satiated and the baby is the hunger is filled, like the baby is satiated now? How do we understand that? Anybody? How will the baby tell us that okay, now I am full, I will eat later again?
Baby will sleep and will close the mouth.
Yes.
Will not, even if you stimulate, baby will not get up.
Yes. So as we know,
Baby will move out of the breast also.
right.
And will
So
not want to
all
go back
these,
to the breast.
as we have if you can recall, we have discussed about the 9 behavioral signals of the baby. So there also we have learnt about how the baby has different stages before feeding, and then after it is done with the breastfeeding. And then definitely, so now the baby, when the baby has reached the satiety, so the baby will now close his or her mouth and go off to sleep again, right? So these are very important. There are many women around us, with us, who are not really well informed about all these features. So maybe they know that okay, this is happening, but it is very much required to make them understand, okay, this is how the baby is trying to speak to you. So these are the hunger cues, or what after the baby is full. So these things should also be forwarded, or these things should also be spread to the different women of different strata around us, so that the proper breastfeeding techniques can be taught to them, and also when they are supposed to feed their child and how they are supposed to feed their child. So all these can be very carefully mediated as well, right? So the answer to this question, as all of you have said, the baby is hungry. So we'll move on to the next question. If the baby is not receiving proper hind milk, what can it lead to? We have talked about hind milk, what is the importance of hind milk, and why the baby
ma'am.
needs it. Yes,
C.
C. Right. So would any
Option C.
right? Yeah. So option C is the answer, that the baby would not be able to gain weight. So can anybody just help me recapitulate why the hind milk is so important?
It helps in baby's weight gain
Hmm?
and it also helps in getting the maximum nutrients for the baby.
Okay.
It contains fat,
Yes. Yes.
good fat.
Yes. So
And it
please
contains
remember.
omega-3 also, which is good for brain, baby's brain.
Yes, yes. So we have discussed about the fats that are present in our previous sessions, and how will the mother understand that whether these fats have been given to the baby or not, right? So the hind milk. So as we have discussed, so the first milk which comes out, it is called the colostrum, right? And then there is a transition phase where there is a transition milk, and then there is a mature milk. So the mature milk has got a fore milk and a hind milk, right? So this hind milk is a more thicker version of the mature milk as compared to the fore milk, and the hind milk has got more of fats. So these fats are the good fats, as you have said, so the omega-3 fatty acids. So the two most important omega-3 fatty acids which are present in hind milk, these are the EPA and the DHA. Please go through the previous sessions as well, and we have studied all these things. So EPA and DHA, they are very much required for the brain development and the all over health of the baby. So it helps in the brain development, it helps in the eyes, it helps in the heart, for heart and eye. So all these it is very much important for the growth and development of the baby. So this hind milk is full of these good fats. Now when the mother is breastfeeding the baby, so it might happen that the mother has breastfed the baby, and now she doesn't know whether there is any more remnant of hind milk or not, right? So we have discussed this in the last session. Can anybody let me know how do we inspect as to whether the hind milk is remaining, or now the mother can shift the baby to the opposite breast? Can anybody tell me how to inspect for the hind milk? Yes.
Pressing the breast, and if there is a thin milk is coming, then definitely you should continue on the same breast. If there is a thick milk or like a hind milk, then I think if there are very few drops, means that breast is empty,
Yeah.
and you can change her to the other breast.
Yes, yes. So somebody had raised a hand, I think, Diet Junction. Yes, yes. Please go ahead.
Yeah, so the same thing, like we have to cover the breast and check if the thin milk is coming, so definitely, but if the thick milk is coming drop by drop, or it's not coming continuously, flow is not there, that means the hind milk is almost over and we can shift the child to the next breast.
Right, right. So this is to be remembered, that the hind milk is so much important that the mother needs to be informed that okay, it is not that I'm only Could you please send the YouTube link of the answers discussed? Okay, Yamini, Arul, the links for the problem solving sessions, they have already been shared to all of you. So please, go through the portal. You can access it from there, right? Okay, so yeah, I'll move back to the question. So we have discussed that why hind milk is so important. So it has got a maximum of fats, and this fat needs to be given to the baby so that the baby can have proper initial growth and development. And it has been seen that many a times what happens, if the mother doesn't know that whether the fore milk is being given to the baby or the hind milk is going into the baby's body, so it might happen that the baby is not gaining the the proper amount of weight that the baby is supposed to gain within that period of time, right? So for very good weight gain, it is to be kept in mind that the hind milk is given to the baby, right? So the answer to this question is the baby will not be able to gain weight, right? So please remember the importance of hind milk and why the hind milk is so much, it is required for the baby's initial growth and development. And what are the different good omega fatty acids which are present in the hind milk? Okay, we'll move on to our next question. So which of these factors they influence the child's overall development through breastfeeding? Anybody with the answer?
Option D.
Okay.
All of the above.
Option D.
Yeah. So the answer is option D. So we know that breastfeeding is not, it is not a unilateral phenomenon that is happening. It is not a one-directional phenomena. It has the advantages for both the baby and the mother. So it is happening in both the directions. So of course, if one or the other factors, they are not conducive, so that might impact the child's overall development during breastfeeding. So when we are talking about the different factors, so they might be breastfeeding factors. So these breastfeeding factors, these are the local factors which are related to the breastfeeding process, right? Say for suppose, as we can see in this image, it is always advocated that the initial breastfeeding, it should be started within the first hour of birth. So if somebody is unable to start the breastfeeding within the golden hour, so that might impact the overall growth of the baby. It has been seen that the baby might be, might be malnourished. The baby might not be having proper weight gain if breastfeeding is not started within the first hour of birth, right? Then again, if the mother is not able to express her milk properly, and there are possibilities of the mother not being able to get the adequate supply of milk, then if there is improper latching, as we can see, this image shows that the mother is using something which is called as a artificial nipple or a nipple shield, something of that sort, and the baby might not be able to properly latch on to this device which comes in between the lips and the mother's natural breast, right? And then again, if you prematurely start feeding your baby with formula milk and other milk substitutes. So these are all these local breastfeeding factors which are very important and which needs to be taken care of so that the child gets the optimum kind of growth and development through this, right? Second, mother's psychological well-being. So as we all know that postpartum depression is a very it is a very significant thing that can happen to a lot of women. It is not something which has come straight from storybooks, but it is very much there, and it is also very important that the mother bonds emotionally with the child. But there might be few instances where the mother is unable to bond with the child, or the mother is not able to take care of the child, or the mother is very young and is underconfident as to how she will be taking care of her child or how she will be breastfeeding her child. So, and it can also depend on, like here they have mentioned the COVID scenario and the different stress through which the mothers can go. So all of these psychological factors, they also impact the entire process. And also if we consider the mother's physical status, so if the mother has got diseases like diabetes mellitus, sugar or blood pressure, or if the mother is malnourished, or if the mother also has habits of drinking alcohol or smoking, so these have also been found to adversely impact the health of the baby, right? And if there are cases where there are mothers who have had an episode of mastectomy, so unfortunately in these kinds of cases the mother might have to feed the baby from one side. but still the nature has gifted women in such a way that the milk in one breast is also adequate to feed the baby if the proper breastfeeding techniques can be employed. So as we have just discussed, so cumulatively all these factors, say the breastfeeding factors, the psychological, the mental well-being, and also the physical health of the mother, so all these factors are cumulatively important, and they contribute to the overall development of the child, right? So we'll move on to
Sorry to interrupt.
Yes,
Can
yes.
these images be shared in some of the WhatsApp group for us to, or email also,
these images.
separate? Yeah.
Are you okay? So these images are there in the recorded lecture. So I mean, these are from the tutorials only.
Small.
Sorry.
No, it will be in the same format, small, right? So if we can
No,
get it
no,
and
no,
then-
no, no. So
Yeah.
these are the screenshots that I have taken for the convenience of the problem solving session. So these are available in the recorded lectures. So images won't be an issue. You can go through the recorded lectures. The images are all there. Okay.
But on the same size?
No, it's not the same size. I mean, is there any specific reason why you need the same size?
No, because it's actually, if you see the breast pattern, it's too small for us to identify, find out what exactly can be an issue.
Okay, okay.
right. This
So
is an
yeah,
example.
like for if I can zoom, no, I don't think so. I can zoom in. Yeah.
Difficult to zoom in, that's why I
Yeah.
asked.
So this image, I mean, for the session, I have just cropped it from the recorded lectures, but these are all there in the recorded lectures, so you can go through them. And I mean, these look very small because I have just taken the screenshots and put it here. But as I have just said, you can go through the lectures and these images are there. Okay?
Okay.
Yeah.
Yeah, thank you.
So we'll move on to our next question. Which of these is disadvantageous? Breast to baby movement, baby to breast movement, all of the above, none of the above. What do you think would be the answer?
Option A, ma'am.
Okay. Anybody else? Anybody else who would volunteer? Okay, right.
First one.
Yeah. So the question says which of this is disadvantageous, right? So of course we can see one is breast to baby movement and one is baby to breast movement. So as we know that it is a thumb rule that the baby should be adjusted according to the breast position, right? So it shouldn't be like the whenever the mother is breastfeeding the child, it shouldn't be like the breast is being the breast is positioned according to the stagnant position of the baby. The mother shouldn't be having elevated shoulders or curved shoulders, or the mother shouldn't be bending forward. So all these things are not desired, so and those can be disadvantageous to the entire breastfeeding procedure. So the movement, the proper movement should always be the baby to the breast tissue, right? So yeah, as most of you have correctly said, the breast to baby movement is disadvantageous, right? Okay, we move on to the next question. Which of these should be avoided?
Option D.
Okay,
Option D, ma'am.
right. So all of you have unanimously said option D, and that is very correct. There are a lot of situations where mothers have been advocated to use these things. Like we can come across a lot of women in the West advocating the use of breast pumps, right? So they use these breast pumps and they store the milk and then they feed the milk to the child. But definitely it has been seen that ideally there is no need of using these unless and until it is very strictly indicated. So if we go through the options, say artificial nipple and nipple shields, right? So there might be situations where women are suggested to, use these things, but definitely there are different disadvantages which are associated with using, again, these, minor devices. So artificial nipple and nipple shields, definitely, if it creates a barrier in between the child's mouth and the mother's natural breast. So definitely a barrier would then again lead to improper latching. So this might also not help the child to get proper, latch on the breast tissue, and it might result into, improper breastfeeding also. So artificial nipple and nipple shields, they are not advised. Animal formula milk, we have over and over stressed on the fact that the breast milk should be started within the first hour of birth, and it should be continued till the there is an exclusive breastfeeding period where till 6 months of age also the child should be fed only breast milk, and then after that till the 2 years of age the child is supposed to be given a complementary feeding. So along with breast milk there can be other forms of food. We have discussed the different groups of food through which the nutrients can be given to the children. So definitely from the birth to the 2 years of age, it is best if the child is given breast milk. And definitely animal and formula milk is not advised. We have also gone through problems. We have learned why animal milk might be difficult to digest for the babies, and why formula milk is also not advocated. The fortified milks are also not advocated in less than 2 years of age. So they usually are deficient in the different micronutrients and the macronutrients, and they do not give the exact amount of nutrition which is required for the baby between the birth and the 2 years of age, right? So option C, breast pumps and feeding bottle. Definitely when the mother can initiate breastfeeding properly, so there is no use of breast pumps and feeding bottle. And it has been seen in various studies that if mothers, definitely the natural breastfeeding, it leads to the proper growth of the child as compared to breast pumps and feeding bottle. So the importance of natural breastfeeding, I think has been stressed over and over again. So the answer to this question is all of the above. So all of these should be avoided. So we'll move on to our next question. How much is a desirable daily weight gain for babies on adequate breastfeeding until 3 months of age? Anybody?
Ma'am, option A.
Option
Option A.
Okay, right. So as all of you have said, it is option A, 25 to 30 grams. So as we have just discussed, that it is very important that till 6 months of age, it is an exclusive breastfeeding period, right? So the mother needs to give, or the mother should give, breast milk to the child till the 6 months of age. And this is very much important so that the child is able to get the proper weight, right, and the proper development in the initial stages. So we have how much what is the nutritional status of the child, and how will we monitor that? So this needs to be monitored through a thorough checking of the weight of the child. So it has been seen that if the child is gaining at least 25 to 30 grams every day, so there's a daily increase of 25 to 30 grams until 3 months of age. So this is a very desirable situation. So if we consider the daily weight gain, it is around 25 to 30, right? Okay, so we'll move on to our next question. Prolactin is highest during which time? Anybody with the answer? Okay.
Option B, ma'am.
Okay.
B. Option B.
Okay. So somebody had raised a hand. Right. Okay. Correct. So as all of you have very correctly said, that it is night and early morning. So now let us learn a little bit about these two very important hormones, which are prolactin and oxytocin. So we have come across oxytocin through our previous sessions, right? So this oxytocin, it mediates the letdown reflex. So as we have seen that whenever the baby is breastfeeding, and this generates this oxytocin or the letdown reflex, because of which the mother's brain is being given the signal that okay, more milk now needs to be supplied and it needs to be ejected out of the breast, right? So these two hormones, the prolactin and the oxytocin, they are very important hormones when we are considering the production of milk and also the supply of milk, right? So as we can see that here we have oxytocin, which is a milk letdown reflex, and the prolactin. So the prolactin is basically helping in the formation of the milk. So this prolactin is very much required for the formation of milk, and oxytocin is helping in the release of milk, right? So prolactin is a hormone which is present in both males and females, but definitely the role is expressed in the females only, where it is being used for the milk production, right? So now, what is the importance of this prolactin? So this prolactin, the levels, they increase during night and also during the early morning hours. So if there is more of prolactin hormone, so there is more of milk production, and hence the mother should feed the child at least for 3 to 4 times during the night. So as we have discussed that at least in 24 hours the mother should feed the child for 10 to 12 times, and during night it should be around 3 to 4 times. So there are a lot of mothers who feel that okay, we shouldn't feed the child because that might disturb their sleep, but since the prolactin is so hyperactive during that period of time, and it is the highest during that time, so it is very much imperative to use that milk production which is happening at that specific period of the day, right? So hence it is also important for the mothers to feed their babies at night. So yes, the correct answer is night and early morning. And can anybody tell me when, just an additional question, when is it the lowest? When has it been found to be the lowest?
Most of them say it is during evenings they find it to be very low.
Yes, correct. So it is during the dusk hours or during the evening when prolactin has been found to be at the lowest levels. So we'll move on to our next question. So what is a behavior that happens in the early hours of life in which the baby naturally attaches to the mother's breast or something else? What is the answer to this?
Option A, ma'am.
Okay. Anybody else? Option A, imprinting. Option B, outprinting. Option C, imprinting. Option D, printing. So you have said imprinting. Does anybody know what is imprinting? Okay, so we'll move on with the answer. So imprinting is basically, a term, a behavioral evolutionary term, which was coined by Konrad Lorenz. So he had done these experiments with goslings. So he had seen that he had kept few goslings with the mother goose, and he had kept few goslings separated from the mother goose, and he was the one who was in more contact with these goslings. So what he found, that these animal progenies or the children of the different animal species, so they had this inherent ability to recognize and to socially bond with their parents, and this was an evolutionary mechanism, right? So it was also seen that these goslings who were kept separate from their mother, they had started thinking of the human as their mother, right? So in case of humans also, this is something similar which happens. So this baby also has an inherent behavior of getting this ability to treat the to treat the mother's breast or something else which is being introduced at that time as the mother's breast, for the evolution purpose, right? So it is an evolutionary phenomenon which is happening. So now, say for suppose there is somebody who did not initiate breastfeeding, right? So if somebody hasn't initiated breastfeeding and she initiated bottle feeding for the first time, right? So the child will now have the tendency of treating that as the normal. So the child will be it will have more tendency towards feeding from the bottle or any other source. So the child will now be having that ability or the tendency to treat those as the actual source of milk, right? So hence, to get all the advantages of breastfeeding, so this should be initiated from the first hour after birth, right? Hence all these bottle feeding and other kinds of substitutes which can be used for feeding the child, these should not be initiated from the first stages. So hence there is no alternative to breastfeeding. And this is a very interesting concept. If somebody is interested, you can go and read about this imprinting, how it was actually discovered in the animal species, and I mean in different animal progenies, and then how it came to be established in humans, and when it gets established in humans, what is the time period. So if you are interested, you can always go to Google and learn about it. So given the question, yes, imprinting is the correct answer. Any doubts regarding this? Anybody with any doubts? No, right? Okay.
No doubts.
Yeah. So outprinting, imprinting and printing, these are all, they don't mean anything. So it's imprinting. So let's move on to the next question. The baby might swallow too much because of the nipple shield. Okay.
See, ma'am.
Right. So as everybody, you have very correctly said, it is C. So as we were discussing that nipple shield, it is a very, so the nipple shield, it is a very, commonly used minor device, you could say, or a barrier device for mothers who might have some differences in their nipple morphology. So they might be told to use these nipple shield, or maybe if somebody is not able to, get proper latching through the different techniques, or if somebody is having some injury to their nipples, so that can always trigger them to use these nipple shields. But again, the most disadvantageous part of this nipple shield is that if it doesn't sit properly to the contour of the breast and the contour of the nipple, so this barrier, it might end up in pushing in air into the baby's mouth. So instead of milk, so the nipple shield, it has got holes which is allowing the milk to go into the baby's mouth, right? So if the fit is not proper, or if there is no proper suction which is being maintained, then the air will definitely ingress into the child's mouth. So hence the most disadvantageous part of these nipple shields which are commercially available, and a lot of people, they are advocating the use of nipple shields, it is that instead of feeding the milk to the child, there are chances of letting the air into the baby's mouth. So yes, option C, air, is the answer. So we'll move on to the next question. Which of these can lead to sore and cracked nipples in mothers? Excuse me.
All the above, ma'am. Option D.
Right. Anybody else? Okay. Right. So, all of the above is the correct answer. So, now when we are talking about sore or cracked nipples, so this is a specific kind of injury which can happen to the mother's nipples. They can become dry, they can become itchy, and they can become inflamed, and this can be due to various reasons. So, say for suppose if the baby is not able to latch onto the breast properly, and that is leading to a nipple feeding. So if there is nipple feeding, and then the nipple might also hit the hard palate of the baby, so this might cause an abrasion, or this might cause injury to the nipple. And if it is continuously happening, if the mother is not cautious about it, and if it's continuously happening, so definitely it will make the nipple inflamed, and that might lead to sore and cracked nipples. Second is babies with tongue tie. So as we know that there might be a lot of babies where they have tongue tie. So the tip I am guessing there are people from different backgrounds. So if you don't know what tongue tie is, so it might happen that some babies, the tip of the tongue, it is attached to the lower bone structure. So the baby is not able to protrude his or her tongue, right? So this is called a tongue tie. So if the baby is not able to protrude his or her tongue, so then he will not be also able to get that proper latching. So as we know that when the baby is trying to get the latch, it is the lower lip which needs to go and which needs to fall on the curvature of the lower areolar region. So now if the baby is not able to protrude the tongue, then obviously the curvature of the lip will also not be falling properly on the breast. So this might also lead to an improper latching and improper breastfeeding technique. And third, routine cleaning of the breast after every feed. So there might be people who routinely clean their breast after every feed. I mean, normally, right? So this is also not to be done, because they might lead to the formation of dry nipples. So hence these are very little things, but these are important things which need to be known, which need to be kept in mind, and which need to be propagated to other people who do not know about it, right? So yes, as we can see in the image also, we have a normal breastfeed where the lower lip is very beautifully falling on the curvature of the lower areolar part. And then we have a tongue tie case where the nipple is not being able to be properly inserted into the baby's mouth, and this is an improper position in which the breastfeeding is being done, which can lead to nipple injury, right? So the correct answer definitely is all of the above. So we'll move on to our next question. Are flat or inverted nipples hindrance to breastfeeding?
No, ma'am.
Right.
No, B. No, ma'am.
Right. So as we have gone through it, physiological changes or anatomical changes will be there in every woman, but that doesn't mean that it is a deformity, right? So somebody might have a plump or an optimal nipple, or somebody might have an inverted nipple or a flat nipple, but that doesn't mean that they are incapable of breastfeeding. So if they are motivated and if they are educated through the proper breastfeeding techniques, so definitely the breastfeeding can be carried forward without any hindrances, right? And as we had just discussed, so in case of flat and inverted nipples, people are advised to use these nipple shields, right? So hence this is also very important that we can keep in mind that if the proper breastfeeding technique is being is being used or is being exercised, then these kind of external parameters also, they do not need to be employed, right? So the correct answer is no. Okay, so breast milk which is frozen solid in a separate freezer will be good for?
Option A, ma'am. 3 to 6 months.
3 to 6 months.
Right. So we have discussed this in our previous session, but I would just like to go over it once again, since there was somebody who had asked about the storage of milk. So if we look at the different types of breast milk, so if it's a freshly expressed or pumped milk, so it can usually stay till 6 hours. So like it is set from 3 to 6 hours. So at room temperature, it can stay till 4 hours. If it's kept in the refrigerator, it can be kept till 4 days. And if it is kept in the freezer, it can stay till 6 months. So as we have in our options, 3 to 6 months, right? Next, we have thawed or previously frozen. So if somebody has already frozen the breast milk and thawed it once again, then how long can we keep it? How long can we store it? So if we are keeping it at room temperature, it should be around 1 to 2 hours. If it's being kept in the refrigerator, that is normal 4 degrees, it can be up to 1 day. But if somebody has already thawed frozen milk, it should never be refrozen again. So this is to be kept in mind, that if somebody has frozen breast milk once and he or she has taken it outside, thawed it at room temperature, and again trying to refreeze it again, so this is a wrong thing to do. So once thawed breast milk should never be refrozen again, right? Okay, so now if we have breast milk which is left over from a feeding, so this is also supposed to be used within 2 hours after the baby has finished feeding, right? So yes, so please go through the different storage guidelines which are there, how breast milk can be expressed and which kind of breast milk can be stored under which conditions, right? So yeah, I think, yeah, so this is the last question for this session. But before that, I would just like to discuss, somebody had posted a query: new mother is having trouble with attaching the baby deeply to her breast and getting more milk by day 3 of birth. So what could be a possible reason among the following? So if initially the mother is having difficulty in attaching the baby to the breast and there is more milk coming in 3 days. So whenever we are talking about more milk coming in 3 days, we know that the colostrum will now be slowly diminishing within the first 2 to 4 days, and it is the mature milk which is being forming, right? So if you consider both the situations, that the mother is not able to get the baby latched on properly and also the mature milk is forming, so that means the baby was not being given the colostrum at the specific time. So if we see the options, yeah, so maybe I'll just share this. Is it? Yeah. So as you can see the options, option 1, breastfeeding was not started within an hour of birth. So this should be the correct option. Okay. So I think, yeah, the person who had put this query, I think your doubt has been cleared.
Yeah, yes, ma'am. Thank you.
Yeah. And second question is, mother complains about reduced breast milk supply. What could be a possible reason among the following? So if you consider the options, say for suppose deep latching. So definitely deep latching is not the answer. It cannot be a reason for reduced milk supply. So if there is proper deep latching, then there will be more supply of milk and there would be proper breastfeeding continuing. Then small breast size. The breast size doesn't have anything to do with the breast milk supply here directly. Not using a nipple shield, also it is not the correct option. So the poor latching or nipple feeding. So as we have discussed, if the baby is not able to properly latch and there is nipple feeding, so that might lead to the reduction in the milk supply. So the answer for this question would be poor latching or nipple feeding. Right?
Thank you, ma'am.
Yeah.
Thank you so much.
So I think the rest of the queries also I have discussed. Okay. So somebody had put a query regarding washing hands post C-section, right? So the washing hands part, which has been mentioned in the preparation of the mother in the recorded lectures, so that is obviously not specific to a cesarean section situation, right? So please don't get confused, and it has been given as a general preparation as to what is to be done when your child in the normal scenario when you're supposed to breastfeed your child. So that is not it is not applicable to the operation room scenario. Okay, so
I just want to have a question.
yes,
In
yes.
case of poor latching, feeding express breast milk with a is a good for the first few days after birth, because during these days only a small amount of milk is needed. Spoon, paladai, small cup, nifty cup, everything is fine, no? Or spoon only.
Yeah, so actually, it is spoon. So the answer should be spoon, but then again, can you just go through the question again? What was the question?
In case of poor latching, feeding express breast milk with a dash is a good for the first few days after birth, because during these days only a small amount of milk is needed.
Okay, yeah, the answer should be spoon. But yeah, there might be different implications to the question also. So maybe I'll get back to you later.
In NICU, we never use spoons, we use only
Ye-
paladai.
Yes, so that is why. Because this has been shared. So yeah, maybe I can just ask regarding this and get back to you.
And whether the pregnant ladies can breastfeed. And my doubt is, because we always tell them to feed, most of them don't feed. Till how many months it is, or it is throughout the pregnancy, because there is some different word for that, no? Pregnant lady feeding the other child.
Yeah, pregnant ladies can breastfeed all throughout. As far as I know, they can feed all throughout. But definitely, if you want the specific timeline, I can go through some specific guidelines and I can let you know.
Okay, thank you.
Yeah. And also, somebody had raised a query regarding whether cancer patients are capable of breastfeeding or not, right? So, there are some, maybe I can just share it. Yeah. So, is the document visible?
Yes, yes, yes.
Yeah. So there was a query regarding whether cancer patients or patients who are undergoing chemotherapy at the moment, they are capable of breastfeeding or not. So if anybody is interested, I can just share this document with all of you, and you can go through it, where they say that this is by the Academy of Breastfeeding Medicine. So they here have specified that during chemotherapy it is contraindicated, but definitely there are specific times as to when it is not a contraindication to breastfeed. So if somebody is receiving chemotherapy, then there are some I'll just show the table. Yeah, so these are the half lives, and these are the recommended minimum waiting period that the Academy of Breastfeeding Medicine have advocated. So these can be taken into consideration when we say that, okay, it is contraindicated in chemotherapy patients or not. So it is not entirely contraindicated for cancer patients, but definitely there are some situations where the mother cannot breastfeed while taking the chemotherapy sessions. But it is not indicated, it is not contraindicated throughout the entire period. So definitely mothers, even even mothers who might have cancer, they are capable of breastfeeding very safely. So I don't know whether the person who had raised this query is in the classroom now or not, but I can share this document.
Yeah, please, that would be of great help. We can.
Sure.
get
Yeah,
more
please, ma'am,
insight
share.
on it.
Yes. Just give me 2 minutes. I'll just share this.
Version of this.
A downloadable version. I am not sure whether I can share
If you
the.
can share the link, probably we can download it.
Yeah. I'll just share the link with you all. Mhm. Yeah, just give me 2 minutes. So this is the DOI of this paper that I have come across. So if anybody is interested, you can go through it, and also you can go through the different protocols that have been advocated by Academy of Breastfeeding Medicine, and I think it would be really informative as well. Can anybody confirm if you're able to access this or not, the document?
Access, ma'am.
Okay. So for today, that would be the end of this problem solving session. I hope it is of some help to you people. Any suggestions? Anything before the end of today's class?
No, ma'am, very helpful. Thank you.
Okay.
Thanks, ma'am. Good night.
Okay, good night. So we'll meet again the next Tuesday. Thank you for joining the class. Okay.
Thank you, ma'am. Thank you so much.
Thank you, ma'am.
Okay. Thank you.